Hi, my name is Lucia. I'm 18 years old. I was diagnosed with severe Crohn's disease at the age of 6. And in June, I came to Mount Sinai for 2 weeks for surgery related to the Crohn's, and I've been doing pretty good ever since. I'm a psych and political science dual major. Currently, I'm pre law. It's just kind of been a passion of mine. Both my parents are lawyers. I'm a competitive dancer and I'm continuing to do that in college, which is great and it's a lot of fun. I've been dancing since I was 3 years old. Mainly, I specialize in contemporary and lyrical. It's really given me an outlet in my life. It's been just like a huge part of my life for as long as I can remember. So a few of the things that went well was definitely getting super involved with Child Life and Kid Zone, which is just kind of like the little playroom area that patients can hang out at. It was super fun being down there and playing games and hanging out with everybody and getting to snuggle with Summer and Professor and Icy was just definitely like the highlight of my experience. I love Summer. Mount Sinai has, I think, 3 dogs now, but when I was there, I would hang out with Summer almost every day. She was amazing. I love her. And then near the end, I also got to hang out with Icy a little bit. And all the doctors and the nurses were super nice too. I mean, I'm really appreciative because they were all amazing. And I still remember people asking me about like what I was looking forward to after we were getting out of hospital, or I was super upset coming out of surgery. So people just like calming me down, holding my hand, telling me that it was going to be okay because the anesthesia drugs were making me super emotional. I still remember everyone, and I still remember just like the tiniest words of kindness. They make a huge difference, and I still remember it. I was so young getting the diagnosis, I don't really remember. Crohn's has just been a part of my life for as long as I can remember. I'd say finding out that I need surgery was terrifying. There's no really better way to put it than absolutely terrifying. I had my surgery right at the beginning of June. I was dealing with those feelings of being super scared for the surgery, but then also just feeling like super left out because all my friends were like on vacation and summer break, and I was in the hospital. I think maybe there were some problems with communication just because like there were multiple teams involved in my case and like sometimes not everybody would be completely up to date and it just led to confusion. We didn't really know what was happening because people would tell us different things and it didn't really help in an already hard situation to just not be completely clear and transparent about what was going on. I think mostly they would just give me choices like, oh, do you want this medication in the morning or at night? Or do you want to tell me when you're ready for me to pull the JP drain out? Just giving me choices. It makes a huge difference in especially a surgical recovery situation where really you get no choice in the matter. My message to doctors and nurses for interacting with a teenager would be ask us about our life outside of the hospital. I really liked it when they would do that because during a kind of dark time in my life, it just reminded me that I had a life outside the hospital, and I really liked getting to talk about that. But then also just like explaining things in words that we can understand and giving us as much choice as possible in the situation. I think the only way out of it is through it, but uh, I think just talking with my friends and my family and just like letting myself feel sad, letting myself like this is unfair, like it's okay to be mad, it's okay to be scared, it's okay to be sad. I think that would be my message for any other kids and teenagers out there going through this. Like it's okay to feel those emotions, but don't like let yourself be in those emotions forever. Also, just like having fun at the hospital was huge. Like truly, like the kid zone and child life and the dogs. It was amazing. Cause like, yes, I did not want to be in the hospital, but it was really just like a bright spot of my day. For me, just like art is a great way to cope with my feelings. It's very therapeutic for me personally to like get to color and draw and play games and all that the zone allowed me to do. It's a great distraction from just pain and everything you're going through. And it's just like something to do in a place where there's not really a ton of entertainment or distraction around. While I was in the hospital, I did get to do a few pieces of art. They have a magazine called Reflections that patients can publish in. So I did get to create a few things for the Reflections magazine, which I'm super excited about. My advice would be have a schedule, have some sort of routine, especially I know 2 weeks isn't the longest time, but it felt like a long time for me. And just having a routine of like what to do every day was huge. Get involved. If you're allowed, obviously, go down to the zone, go down to child life, get involved as much as you can. It really does help so much. Be patient. Things are going to get better. It might take a while, but they are going to get better.